Beating Endo: How to Reclaim Your Life from Endometriosis by Iris Orbuch, MD, and Amy Stein, DPT. Read by Crowe. A note before we begin. Don't forget to download the accompanying enhancement PDF from your audiobook provider, or go direct to www.harpercollins.com/audio/beating endo. It contains useful information, resources, and more, and will be referred to throughout as the enhancement. Forward. Bojana Novakovic. I had pelvic pain for more than 2 decades and didn't know why. As a teenager, I was told it was normal for girls to have painful periods. When I became sexually active, I was told it was normal for sex to hurt. A laparoscopy in 2005 came up negative for endometriosis. I now know the surgeon most likely did not know what she was looking for. Because endo had been ruled out as a cause, I was told the pain was in my head, or that sex hurt because I was uptight and anxious. Everyone I turned to pointed the finger back at me. So I started looking inward. My anxiety increased. The more pain there was, the more I worried that I was doing something wrong. This cycle of confusion, pain, and discomfort wreaked havoc on my mind, body, and central nervous system for 15 years. I'm no scientist, but I can say with complete confidence, there is nothing normal about knife-stabbing pain during your period, nausea with bowel movement during your period, burning, itching, tingling pain sporadically throughout your cycle, and definitely nothing normal about pain during intercourse. Even though women go through the painful act of childbirth, pain is not synonymous with being female. Possessing female reproductive organs doesn't condemn you to eternal pain. We all know that life hurts. We all struggle. But pelvic pain is not a metaphor for life. It's a real ailment with causes and conditions, and it can be treated. My cause was endometriosis, but it lasted so long that I grew used to its symptoms and figured out how to put up with them. In November 2017, I started to experience severe lethargy and intestinal pain that 6 months of testing finally identified as SIBO, small intestinal bacterial overgrowth, which, like endo, is an inflammatory condition. By that time, I was also seeing a physical therapist specializing in pelvic pain during sex. Both the GI doctor and the physical therapist suggested I see Dr. Orbuch, proposing that the symptoms I was experiencing could be from long-standing endometriosis. It's difficult for an intelligent, well-read, independent woman like myself to contemplate that what a medical expert had once assured her was not the cause of her lifelong pain might well have been the cause all along. It's hard to come to terms with the fact that the medical professionals got it wrong and that maybe I should have listened to my body. Instead, I didn't have time to keep digging or the confidence to tell the pros how to do their jobs. I had a life to live and ambitions to attend to, and the experts kept telling me the pain was just something I needed to live with. Dr. Orbuch and I spoke for over an hour, not the usual 15 minutes allotted by insurance providers for these appointments. We discussed my symptoms dating back to when I was a teenager. "Is this the pain you feel during sex?" she asked during my internal exam. I jumped in agony. "That's endo," she said. In my 20 years of visiting various professionals, no one ever found the pain I feel with such precision. It was obvious that Dr. Orbuch knew what she was talking about. We discussed surgery. The only way to actually diagnose endometriosis is a biopsy. I was afraid the same thing would happen as almost 15 years before. "What if you don't find anything?" I asked. "I'll find something," she said, and she smiled confidently. It's a bittersweet feeling to finally name what ails you after so long. On one hand, it's a relief because you can finally take action. On the other, endometriosis can feel overwhelming.
Sample complete. Ready to continue?